about a study done in the garment industry workers in Tirupur and Bangalore, part of South India. So we studied on the risk factors which are associated with the presenting mental health symptoms among them. So the World Health Organization says that mental health conditions such as depression, anxiety, and harassment at workplace have significant economic impact globally. And it is underestimated because of stigma, and also quantification is difficult. So in our study, we aim to assess quantitatively the prevalence of mental health symptoms and the associated risk factors among garment industry workers. And we selected 24 factories, and the category of workers that we interviewed were tailors, checkers, cutters, and fabric issue helpers, and ironing and operators at the factory floor level. 1,194 workers were interviewed, and we asked them questions on basic socio-demographic factors, and we administered patient health questionnaire to assess for depression, Hamilton Anxiety Rating Scale, which is a clinical tool to assess anxiety, and also to assess work-related scale, we used stress. We used work-related quality of life questionnaire. As we all know, most of the workers that we interviewed were females, 78%, because it's a feminized occupation. And many of them were single also, 46%, because especially in Tirupur, young workers migrate from different districts of Tamil Nadu and come for garment industry for work. 46% were single and 48% married, and 6% were either divorced or separated or widowed. This is the socio-demographic profile of the population studied. The mean age is 29.4. It's a relatively young working group, as we all know in garment industry. And the average years of experience is 3 years. And most of them had an education of up to 9th standard to 10th standard. And the average income was around 9,000. And the monthly family income for them was around 19,000. Ownership of any property or material, because after working for at least for 3 years, what have they owned in their life, we asked. And 65% of them told that they owned at least something like gold or some land and own house. So coming to the presentations, mental health presentations that they had, the most common complaint that they told was stress at work, measured as per the work-related quality of life. 67% had stress at work. And 12% had moderate to severe depression as per patient health PHQ 9, and 6% had anxiety. 9% mentioned that they've always had suicidal ideations in the past 2 weeks, and 7% had in their lifetime, they've at least attempted once suicide. And 10% reported fear due to a phobia for any reason, and 10% had sleep issues. And many women told that we don't have any mental health issues, but my husband is drinking, my husband is smoking. So that also was captured. So 11% of the women workers reported their husband to be consuming alcohol, and 12% of the women had tobacco consumption among their spouses. So coming to the risk factors, because we need to understand who are prone for these mental health issues. So as per the World Health Organization, social determinants of mental health, adverse childhood events are the most common social reasons for poor mental health issues. So in our study also, we observed that those who reported problem family and experience of adverse childhood events, they had the most common mental health issues. So among those who reported phobia, 126 people reported phobia. Of them, 16% of them were having problem family, and this association was significant. So 3 times a person having an adverse childhood event has 3 times the chance of developing phobia. And sleep issues also, those who have problem family have high chances of sleep issue. The odds ratio is 4. And depression is also common. It is twice common among this population. And suicidal ideations and attempts are also common. So this explains the life course approach that is very important when we interview with workers. If they have issues in their childhood, in their family, that will present as mental health symptoms at workplace. Marital dysfunction was another determinant for mental health. And insomnia was a common presentation among those who had marital issues. Depression also present, and suicide attempts, and stress at work exacerbated when they have marital issues. So their coping capacity to face the common stress at work is very difficult when they experience marital dysfunction. Income is one of the main determinants of poor mental health. So yes, ma'am.
Adverse childhood events which we are narrating were they part of the questionnaire or the history taking?
Yes. So
What were the questions related to it?
it's an open-ended question, ma'am. It is actually in India, it's very difficult to capture adverse childhood events. So we ask problem family, and then we ask what exactly did you experience. When they say yes, I have problem in family. When then we ask what exactly did you experience. I've seen my father beating my mother. I've experienced bonding. They say that I've never had any bonding. And then severe loans. So I've seen my father committing suicide. They have died due to any reason, death of a parent. So all this was captured qualitatively and then analyzed separately, ma'am.
All that was categorized into the same heading, that is any adverse childhood event.
Yes, yes, ma'am.
And the problem family related to the narrative discord or things like that was segregated in a different category.
Yes. So when I told about marital issues, that is personal marital issues, like you are married or single or separated, and do you experience? It's a separate question.
We are sorry for some technical issue. Yeah,
Sorry. Yeah.
yeah, you can
Yes.
continue without the picture.
So those who had lack of any ownership of any material or property had high stress at work, and the lower income category was more prone for suicidal ideations. They were not having any other presentations. Coming to the age group of the population, the older age group had a higher chance of stress at work, whereas the younger age group was protected from it. This explains that the younger age group, in terms of what we have experienced, is when we ask the younger population, that is especially the single ones and those who have come and joined the workplace newly, they say that I don't have any issues, I can face whatever stress comes to me. But whereas the older population say that I already have so many issues at home going on, parenting and many issues, that I can't face the stress at work. So that is one explanation for the older age group experiencing stress at work. So we know that as per the World Health Organization, social inequities, poverty and physical environment are one of the social determinants of mental health. In the garment industry, what we have observed is marital issues and then adverse childhood events and income, of course, has a significant impact on mental health presentations. And these explain that such population who are experiencing adversities at home and social environment have less coping skills as compared to those who are privileged. So also qualitatively, people have reported to us, because of all the things going on at home, when we come at work, we have lack of concentration. I take leave more often, and then I come late for work also. These are some issues that they have reported.
Okay, please conclude.
Slides are not moving. Yes. So in conclusion, one of the common mental health presentations among garment industry workers is stress at work. And depression, anxiety and suicidal ideations are present in this population. And the common risk factors are older age group, adverse childhood events, marital issues and income, lower income. So we recommend organization level interventions, peer support, to protect and promote mental health at workplace.
Okay, thank you so much. Thank you. We are sorry for the technical issues. So may we have a question, please? Thank you.
If you have done this study in the workplace, what were the stressors at work for the government industry employees? And that is
Yes, sir. So, stress is quite vague actually when we do quantitative study to understand. So, when we ask the workers what exactly is stress at work, one of the common things that they tell is scolding from, reprimanding from their supervisors. That is one thing. And then very high production targets. That is after the COVID situation, because of all the reduction of workforce, they experience very high production targets. And post-COVID, they themselves are vulnerable now because they lost job for a while, income issues were there, family issues were there. So they are more vulnerable for the production target stress. These are two things that they have reported at the floor level, sir. Yes, we have a major project going on called as the MySpace project in garment factories. And we have trained garment industry workers themselves, selected workers, on lay counseling skills. So they are supporting their own workers. And apart from that, we have trained all the supervisors and the mid-management category on a 2-hour session on mental health awareness and also the best practices on how to handle workers. So we don't advise be kind, be empathic. We allow them, can you come and tell what's your best practice at your floor, at your section? What do you do? So they tell, I am actually called as a brother by my workers. I do, when they come and look upset, I say, no problem, I am there for you. When they ask off, I give a half an hour. So they inspire others to be more kind and empathic at workplace. So we don't do advice.
Okay. Thank you, Dr. Nancy.